Good morning. This is Lynn Sutphin, Public Information Officer at the Michigan Department of Health and Human Services. This is a COVID response data and modeling update with Dr. Sarah Line-Callow from the Michigan Department of Health and Human Services. I'd like to thank our two interpreters today, Amanda and Ken. Appreciate you participating so we can make sure that this is accessible to everyone when I post this recording. All right, Dr. Line-Callow, I'm going to turn this over to you and I will continue to watch for those hands raised. Thank you.
Thank you and good morning, everyone. Lynn, I'm assuming you can hear me all right? Okay.
Yes.
All right. Thank you. All right. So good morning. Our summary today, our percent positivity and case rates are continuing to climb. We're currently at 15.6% positivity and about 491 cases per million people. These numbers have been increasing for the past 6 weeks. And we are more than 300% increased since our previous lows on February 19th. Michigan is now #1 in the nation in terms of our number of cases and our case rates. We're also #1 in the nation in terms of the percent of inpatient beds that are being used for COVID-19. That has increased more than 200% since our February 28th low, and we're now at about 11.9% of inpatient beds are being used to treat people with COVID-19. Our mortality rate has begun to climb again. We're currently at 2.4 deaths per million residents. We had 166 individuals between March 14th and March 20th die due to COVID-19. Our 7-day average testing rate has increased. We're seeing increases in our daily diagnostic tests, as well as our PCR and antigen totals. And the number of COVID-19 vaccine doses that is getting out is also increasing. We have more than 36% of Michigan's population over 16 has had at least one dose of the safe and effective vaccine. Next slide, please. In terms of comparing Michigan to other parts of the nation, there are 26 states that are seeing a 1-week increase in their case rates. 21 states are seeing weekly increases in the number of COVID hospital admissions. This is up from 17 states the week prior. Michigan, New Jersey, New York, Washington, D.C., and Maryland have the highest per capita hospitalized patient numbers in the state. In the nation. Comparing to our Midwest neighbors, Wisconsin, Indiana, Illinois, and Ohio are now all seeing increases in their hospitalization and case rates. Their per capita rates are not near where Michigan's are currently, but we can see that other parts of the Midwest are starting to experience increases as well. The next slide gives an example of some cumulative case data comparing Michigan to our Midwest neighbors, as well as New York City, and Massachusetts. Michigan is the bottom purple line, and we've given you a purple arrow to show which one we are. This is depicting our cumulative incidence per 100,000 population. For Michigan, we have been consistently lower than other states in the Midwest following the spring 2020 surge. Our mitigation policies helped to control the spread of SARS-CoV-2 relative to other states in the Midwest, particularly during the surge in November and December of last year. However, the current trajectory, you can see that we're starting to swing upwards towards the case rates of our Midwest neighbors. And we are also starting to see a slope that's much more similar to that of New York City, New York, and Massachusetts. So looking more at how COVID-19 is spreading in Michigan in the next slide, our statewide positivity is now 15.6%, and we're seeing that positivity increasing in all the Michigan economic recovery regions. 5 regions are now above 15%. And we also see increasing trends at the county levels as well. We're now at 391 cases per million people. And we have which is a 375% increase from our mid-February low. We're seeing increases in all regions in the state in our case rates. Michigan now has identified all three variants of concern that are being tracked by the Centers for Disease Control and Prevention. We have more than 1,800 cases confirmed to have been infected with the B.1.1.7 variant. We have 7 cases identified as having the B.1.351 variant, and now 2 cases confirmed as having the P.1 variant. We know that there are more cases than we are able to identify based on the sample size that we have. And then in terms of the number of active outbreaks that local health is investigating, this is up 14% from last week. And the number of school outbreaks are now about over 300. Since January of 2021, our K through 12 sports transmission, we have evidence that is highest in basketball, hockey, and wrestling. So some of those contact and indoor sports. The next slide gives information about our case trends, positivity trends, and hospitalization trends by Michigan Economic Recovery region. You can see a lot of purple on this graphic here. All regions of the state are over 200 cases per million. The state is at 491 cases per million people. And you can see 2 MERC regions, Detroit and Lansing, are above 500 cases per million, with Jackson almost there itself. Percent positivity is 15.6 for the state as a whole. All regions in the state are over 5%, and there are multiple regions in the state that are over 15%. Based on those increasing trends, we expect to see that our case rates will continue to climb as well. You can also see in the last 2 of the last 4 columns in the graph that our inpatient beds occupied by COVID-19 patients are increasing in all regions as well. So next slide is giving a positivity trend over time. Early in the pandemic, testing was not as robust and available as it has been since July to the present. And our current statewide positivity is a little bit difficult to compare to the spring. However, our positivity is the highest right now that it has been since April 24th. Positivity is definitely an indicator that more testing is needed. We like to see positivity around 3% because that indicates that you are testing enough to capture all cases. However, it is also an indicator that we're going to continue to see SARS-CoV transmission in the state. The next slide gives the county level positivity. 63 of our counties have 10% positivity or higher. You can see the dark purple is really focused around the Thumb region and the northern lower peninsula. And we have 16 counties that have 20% positivity or greater. Next slide gets at our cases by onset date. Cases have been increasing for more than 6 weeks, and we have more than 5,000 new cases each day. And some days we've had 8,000 new cases. The next slide provides information about those cases per million by age group. The rates currently that are the highest are among those aged 20 to 29 and 30 to 39. However, rates for children 0 to 9 and 10 to 19 in red and yellow are at an all-time high and have more than quadrupled from a month ago. So although the 10 to 19-year-olds certainly had the earliest, highest increase in case rates, our 20 to 29-year-old and 30 to 39-year-old currently have the highest case rates. The next slide gives you more detail about the number of daily cases on average by age group, the daily case rate by age group, as well as percent change from last week and percent change from February 19th. Currently highest are those 20 to 29 years of age. They have the highest daily number of cases with more than 1,000 and the highest daily case rate. All age groups under 70 are experiencing an average of more than 200 cases per day. And since February 19th, the case rate increase of the number of cases has been highest among those under age 70 as well. So those last two columns can be a little bit confusing. If we look at the total row, I want to give you a couple of examples of how to interpret these. So looking at the total row, our 1 week change in the number of cases is about a 52% increase from last week. This means that there were an additional 1,671 cases each day this week compared to last. And then comparing between February 19th and now, there were an additional more than 3,800 cases each day this week compared to the week of the 19th of February. The next slide goes into information looking at race, cases per million by race and ethnicity. Cases per million are increasing for all races and ethnicities. And our most recent data are showing that Black residents and Hispanic Latino residents have the highest case rates in the state. So we're starting to see a disparity there. Our next slide is reviewing the numbers of COVID-19 cases caused by variants of concern in the United States and Michigan. The United States is experiencing spread of all three of these variants. There are now 51 jurisdictions that are reporting B117 cases. And the P1 variant, which had been in just a couple of states, is now in 22 jurisdictions. So those are states and territories. For Michigan, you can see the map there. The red on the map are indicating counties where there's both B117 and P1 cases reported. The orange are counties where we have both B117 and B1351. And then the yellow are places where we have confirmed B117 variant in a COVID-19 case. So you can see there are 46 counties that have B117 and 2 counties that have P1. We expect that there are variant cases in other counties as well, and that there are more variant cases than we are able to identify. We do not receive samples for every COVID case in the state. So this would be a minimum number that exists in the state and a minimum range. All right. The next slide gives you some information about outbreaks. So the number of active outbreaks that local health reports back to us on is up 14% from last week. We now have 991 outbreaks. We had 81 new outbreaks reported in the K-12 setting. Following K-12, the greatest number of new outbreaks was reported in the large grouping of manufacturing and construction. We also had 35 new outbreaks identified in skilled nursing, long-term care, or other assisted living. Retail, restaurant and bar, and child and youth care program settings all had reported, local health reported having 29 new outbreaks in those settings. So we are starting to see increases in activity in a variety of settings here. The next slide gives information on the K-12 school outbreaks. We're at 301 total outbreaks. We've seen increases in all age groups, or sorry, grade levels here in terms of these schools, including about 172 high schools that have had an associated outbreak. Our next slide gives some new information to this call. This is looking at the number of clusters and cases that are identified by local public health as they're conducting their investigations. This includes school-affiliated and club, travel, or regional sports. So this would include parents, coaches, and participants, but it would not include spectators, collegiate or professional sports. Since between January of 2021 and the end of March inclusive, we can see that basketball, hockey, and wrestling have had the highest number of sports-associated cases and the highest number of clusters of sports-associated cases. And cases and clusters have occurred in over 15 sports settings. So it's important that we continue to wear masks, minimize social gatherings associated with these teams, and make sure that we're doing social distancing whenever possible. So moving on to how we are doing with healthcare capacity in the state and COVID severity. Our hospitalization and ICU utilization are increasing in the state. Going to go through some detail on that. You can see the summary statements there. Our mortality has shifted and is now increased to 2.4 deaths per million people. That's a 75% increase in mortality rate since our March 9th low. So the first slide in this section is giving you the percent of emergency department visits for COVID-19 like illness. That has now increased to 9.3% of all reported ED visits in the state. And you can see that very sharp rise since the beginning of March. The next slide is giving you the number of hospital admissions for COVID-19 by age group. You can see that currently there are about 463 daily hospital admissions for COVID-19. Over the past week, those who are 40 to 49 years of age have had the greatest increase in their daily admissions and in the percent change in that admission. And 50 to 59-year-old have had the greatest increase if we compare to February 28th, which was our low period for hospitalizations. I'm not going to go into great detail in the next slide, but it does give you a nice visual explaining the difference in the winter and spring surges in terms of the hospital admissions by age group. You can see in the spring surge, our hospitalizations are higher among those that are under age 60. So again, it gives us a good sign that vaccination coverage is helping to reduce our hospitalizations among older individuals. Moving on to moving on to our census within the hospitals. Our inpatient COVID-19 census continues to increase rapidly. This week was up 45% from the previous week. The absolute increase over the past week has been about 1,000 patients, which is the highest absolute weekly change since the spring of 2020 surge. Hospitalizations are doubling every 12 to 14 days now for the last 3 weeks. The next slide gives you this information at the preparedness region level. We can see that Region 6 is showing the most rapid growth this week. It doubled within 1 week in terms of the number of inpatients being treated for COVID-19. There are 5 preparedness regions in the state that have more than 200 COVID positive hospitalized individuals per million population. Region 2 North and 2 South are now more than 400 patients per million population. Moving on to the ICU data. Overall, the census of COVID-19 patients in the ICU increased 41% from last week, which was, again, an increase of 43% over the week prior. All regions have increasing ICU census. The fastest growth has been occurring in preparedness regions 1, 6, and 8. 6 regions currently have 25% or greater of their ICU beds being occupied by COVID patients. So you can see increasing pressure on our hospitals. Michigan Medicine, I meant to thank them for all their work that they do here on these data for us each week. They did some extra work this week looking at forecasting out what these numbers might look like if they continue the way they are going. They estimate that by April 12th, we could be at more than 4,500 hospitalizations for COVID-19, which exceeds our spring 2020 peak census. And for the ICU in the next slide, they're projecting that we could be over 800 patients in the ICU, which is higher than our winter peak ICU census. Our next slide is doing a comparison between last winter's surge and the spring surge for the state overall on the left and for regions 2 North and 2 South. The orange line is wave 3, or what we call the spring surge at the state. And we are seeing that we're about 11%, right now we're about 11% ahead of where we were during the winter surge for the state as a whole in terms of our hospitalization census for COVID-19. For region 2 North and 2 South, they're about 26% higher than they were at this point in the surge during the winter. Talking about mortality, the next slide is giving you information about the age-specific death rate per million people. We're seeing this increase for all age groups slowly. Unfortunately, this does include the 80+ age group. The next slide gives us the 30-day rolling average death per million rate for people by race and ethnicity. White residents and Black residents have the most reported deaths per capita. The death rate for Hispanic, Latino, and non-Hispanic Latinos are similar in Michigan right now. So we're beginning to see a disparity in our mortality rates as well for Black residents, as well as white residents continuing to have a high rate. Let's talk briefly about how public health capacity is doing. Our PCR testing has increased since last week. We're continuing to increase our pop-up testing availability. However, the number of cases that we have, we are really not able to keep up with the case investigation numbers. This week, we had more cases that we were unable to investigate than the total number of cases the week prior. So moving into our next slide, you can see our slow increase here in terms of the number of daily tests. The next slide gives you some examples of the kinds of ways that we are increasing access to testing. The large blue circles are a couple of airports where we're starting to conduct testing, and we're also conducting testing in orange. You can see our spring break pop-up sites. These are places where, as schools return from spring break, students and their families can go in to get tested to see if they have COVID-19. It's a further effort to try and reduce the any introduction of COVID-19 into the school environment. The next slide, just wanted to highlight for folks that CDC has put out some nice infographics related to international and domestic travel. And these recommendations and requirements do differ depending on whether or not you are fully vaccinated or not. So I wanted to highlight that for your perusal later. In terms of our case investigations, we had more than 34,000 cases referred to state and local investigators. We were able to reach more than 8,200 of those individuals. That's about 24% of all cases. So this diminishes, this gap between the number of cases that we have and the number we're able to investigate diminishes our ability to identify outbreaks. It also diminishes our, it reduces by one, our opportunity to talk to an individual and provide education. And it also impacts our ability to collect data on race and ethnicity about these cases. So we're doing everything we can to try and increase the percentage of cases that are investigated. But this is a very large volume to try and keep up with. Our next slide gives you some more positive news. COVID-19 vaccination is progressing robustly. We're 10th in the nation in terms of the number of people with our first dose, 10th in the nation for the number who are fully vaccinated. I'm going to go ahead and jump, in the interest of time, I'm going to go ahead and jump right into the detail slides. You can see here, this is our number, this is our comparison of ourselves in ranking compared to the 20 most populous states. We're 8th in the nation among those 20 states in terms of populations who are fully vaccinated. So very excited to see that complete coverage there. Our next slide gives the number of doses that were shipped and administered. You can also see this information on our website. Something that's very exciting to see is that we've had more than 122,000 doses administered in a single day. So our administration capacity is definitely increasing in the state. Next slide is giving you information on the number of vaccinations or percentage of population by age group that is vaccinated. 55.4% of people 65 and older have completed their vaccination series. So that's one of the reasons why we're seeing our hospitalizations in that group be lower than they were last winter. So very exciting to see that. We also have the next slide, information on coverage by race and ethnicity. We did have a problem with our computation for the Asian, Native Hawaiian, and other Pacific Islander doses. We have corrected that now. So you can see in these numbers that coverage is highest among individuals who are non-Hispanic white race, followed by non-Hispanic American Indian, Asian, Native Hawaiian, or Pacific Islander, Black or African American, and then those of Hispanic ethnicity are at about 13.6%, having received their first dose of COVID-19. These racial disparities and ethnic disparities are the difference between these groups are smaller when we look at those 65 and older, which is a good indication that a lot of our efforts that we're doing in terms of mobile vaccination or other kinds of outreach strategies for these groups are working. I'm going to go ahead and jump to 2 slides down to the slide that says potential COVID-19 vaccination breakthrough cases. We've been getting a lot of questions about this. Michigan is part of the Centers for Disease Control and Prevention's nationwide investigation into breakthrough as our local health departments. So each week we take all of our COVID-19 cases and we match their information up against our vaccination database to identify any cases where someone has been fully vaccinated. So they've received all of their COVID-19 vaccine, and it's been at least 14 days since their last dose. We also look to make sure this person hasn't had a positive test less than 45 days prior to their post-vaccination test. And if someone meets that case definition, we gather data from Michigan Disease Surveillance System and the Immunization Registry, any whole genome sequence data we have, and if possible, we gather respiratory specimens for CDC or for our laboratory to conduct whole genome sequencing. That information is sent down to CDC for their investigators to review and put together with other states and look for trends. Michigan's data up through the end of March, we had identified through this match 246 cases who met this criteria. This is less than 1% of all people who were fully vaccinated on March 31st, by March 31st. So this is not in excess of what might be expected in terms of breakthroughs for vaccines that have up to 95% efficacy. So we're actually seeing fewer cases of potential breakthrough than we had anticipated seeing. This 246 cases did include 3 individuals who died. Those individuals were all 65 years or older. And also we were able to identify 11 cases who had been known to be hospitalized during this time. So in summary, we're not seeing larger numbers than we would have expected. We also are seeing that the proportions of those who are symptomatic, hospitalized, or who have died are lower than those cases who are not vaccinated. And we're continuing to encourage precautions for everyone while out in public in terms of wearing masks, washing hands, and social distancing. Because even after receiving the vaccine, it is possible to become infected with COVID-19. Very rare, but it is possible. So it's important until more Michiganders have been able to be vaccinated and our case rates come down, that everybody continues to wear their mask, wash hands, and social distance in public. And the last thing I'll leave you with is this tipping the scale graphic we have. This is one of the touch points that we use frequently, or I certainly do, in terms of understanding what are the things that are going to reduce spread or cause less spread of COVID-19, and what are the things that are going to tip us towards more spread. You know, unfortunately, it's very easy to become COVID fatigued. It's been a long, more than a year now. However, the virus never gets fatigued. So it's important that we continue to mask and distance, that we move activities outdoors if at all possible, that people get vaccinated as soon as they are able, and that we continue to test and use those tests to isolate so that we're not infecting our neighbors, friends, coworkers, and others. It's important that we are able to reopen activities. I myself got to eat out at a restaurant last night outside. That was very exciting. But I made sure to wear my mask. I made sure to, minimize my conversation with the waitress so I'm not putting her at risk. So just always thinking about these tipping points and how we balance these things in our daily lives. So thank you very much for your time.
Thank you, Dr. Lancal. I appreciate that. Great presentation. Okay, I'm going to open it up for the Q&A portion. Please use the raise your hand option. So I can't see you on the screen, so use it on the here in Zoom. I'm really asking, we have a really full house. Please, no multi-part questions, no multiple choice questions. Can we just stick to please one question per outlet? Thank you. All right, I'm going to start off. Patrick Martin, can you unmute yourself and ask your question, please?
Hi, yeah, Patrick Martin, NBC News. Just wondering what the course of action for limiting outbreaks and sports-related clusters is for Michigan.
I'm so sorry, I was having trouble getting off mute there. So Michigan has a order related to, Michigan has a program with school sports and other entities to conduct testing. We're encouraging use of masks during play, if at all possible. That school testing program, we've shipped out a lot of antigen tests. We have trained every school in the state, as well as a number of sports entities to be able to conduct testing. And that is one of our responses to that outbreak. I don't know if anyone else from MDHHS would like to add anything to that response there.
Okay, moving on. Kristen Seamus, please unmute yourself and ask your question.
Thanks so much for taking my question. Hospitals are filling up again. We're hearing from patients that they're waiting for hours and hours, sometimes 24 hours or longer in emergency departments, just hoping to get a bed. Hospital staffs, again, are stretched to the limits. The governor has said that this is a variant problem, a mobility problem. But at this rate, we're reaching another crisis point. And is there going to be a need to start pulling back again? CDC Director Rochelle Walensky said this morning that the guidance is clear that there should not be any indoor sports. And in a situation where we have youth sports going on in Michigan right now, and we're seeing lots of cases there, what are the steps that are going to happen here to pull this back? Because we cannot get vaccines into people's arms quickly enough. It takes 5 weeks to get fully vaccinated with Pfizer's vaccine, for example.
This is Elizabeth Hertel. Thank you for that question. Same question we've been asking ourselves as well. As Dr. Lancello mentioned, we've implemented the weekly testing protocol for all sports, high school age sports. That went into effect last Friday. We do know that as of this week, I believe indoor sports for the most part will be completed, and we'll be moving to spring those outdoor sports that are less contact. As people have been traveling March and April for spring break, we are encouraging our school districts and our local health departments to consider moving middle school and high school back to virtual for 1 or 2 weeks following those breaks to try to continue to slow the spread of the variant among this age group. We're also in contact often with the hospitals on any resources or support they may need. They are beginning to look at implementing some of their surge plans again. We know that our hospitals are well equipped to handle these surges. We've seen them do it a number of times now, unfortunately, and we will remain here ready to support them in whatever they need. So as we move forward into the spring, we continue to work toward ensuring that people are using the mitigation measures, the continue to masking, continue to social distance, continuing to avoid gatherings, and really focusing on how we can ensure that we are keeping kids safe in school. And those are the steps that we continue to take.
Thank you. Justin Hicks, please unmute yourself and ask your question.
Yeah, thanks for taking my question. Previously in the pandemic, we had goals that were set for the number of diagnostic tests per day that we'd like to see. It was 30,000 at one point. It got bumped up to 50,000 at one point. We've seen testing, you mentioned in this presentation that testing recently has started to go up, but what is the goal? Do we have one in terms of a benchmark of tests per day we'd like to see in order to have a good picture of what the spread looks like within the state?
Sure. So the numbers that we did used to have those kind of testing goals. With the use of antigen tests and the ability of that flexibility there, we have changed our strategy somewhat. We are really trying to target that the testing is available to individuals at the point that they most need the information. Antigen testing can be fairly, it's a very quick, it gives you the answer very quickly. Particularly at these case rates, it's a very appropriate test to be using. However, there is not the same kind of easy pathway for information to the state. It's fairly laborious testing reporting to the state. So we know that not all of the tests, particularly if they're negative tests, I guess I should put it this way. We know that not all the negative test information is coming back to us. So our testing numbers are most probably a little bit of a underestimate of the total testing that's occurring in the state. That said, the strategy here is very much to make sure that we are getting testing into the hands of places where it can be used. So we don't necessarily have a numeric goal around that at this time for antigen testing.
Thank you. Angela Cunningham, please unmute yourself and ask your question.
Thank you for taking my question. You mentioned that Michigan is 8th in the nation when it comes to people being vaccinated, yet we're leading the nation in the number of new cases. At the current rate, will it be likely that you will shut things back down as far as restaurants, businesses, public events where people gather in large numbers? And if not, what's different this time compared to last year this time?
Yeah, again, our focus right now continues on being making sure that we are getting as many people vaccinated as possible. I think it's also important to remember that we still do have a number of restrictions in place that limit gathering sizes pretty significantly. With the age groups that we're looking at, as Dr. Lyon-Callow pointed out, we've been trying to focus on school age, especially when it comes to athletics, and ensuring that we're able to implement processes that allow us to monitor the transmission of the virus among those age groups. And so we've spent a lot of our time on that. Given that that testing protocol just went into practice, we will continue to monitor those outbreaks among those school age athletes moving forward.
Thank you. Jeff Gilbert, or Patrick already did his. Jeff Gilbert, can you unmute yourself and ask your question?
Yes, I am unmute. Can you hear me?
Yes, we can.
Okay, real good. I would like to ask about holiday gathering, whether you saw any spike from gatherings during St. Patrick's Day, and whether you expect to see spikes. I know it's a little early after Easter, but spikes from family gatherings at Easter, because anecdotally it appears there were a lot of gatherings at both St. Patrick's Day and Easter.
Yeah, this is Sarah. I do not have information on sort of St. Patrick's Day specifically associated gatherings. Last spring, we certainly did get a bump in cases from the holiday season at this time of year. So we will certainly be looking for that.
Courtney, please unmute yourself and ask your question.
Hi, thank you for taking my question. Courtney Bennett from Mid-Michigan Now, NBC 25 and Fox 66. Governor Whitmer appeared last night on CNN and said that the state could possibly reopen this summer, but we're experiencing these high case numbers. Is that possible at the current case rate?
So I think this is Sarah, I think it's very difficult to predict what our case rate will be this summer. Given the impact that we are seeing of vaccination, I would not anticipate that we would be, at these levels of cases during that time. We're working hard to leverage our vaccine strategy as well as our testing strategy to help to reduce spread. So for example, we were able to leverage some Johnson & Johnson vaccine to get to counties that were experiencing some of the highest case rate increases in the state, so that they could work, to get that vaccine out to those who are under age 60. So I think there are a lot of different techniques that we're using to get people vaccinated and reduce transmission. And I'm anticipating that, you know, we will not be looking this way in the summer. Now, with COVID, I guess I should learn not to say things like that in public because we don't know what the virus will do. However, based on what I understand now about how the virus works and how the vaccine is working and how well the vaccine campaign is going, I'm very optimistic for the summer. Thank you.
Darren Cunningham, can you please unmute yourself and ask your question?
Okay, all right, thank you. You can ignore my email, Lynn. I found the icon for raising my hand. So, yeah, I just emailed you about that. Okay, question. Mutations seem to have occurred quickly. Is that the case? Are these mutations, these variants, these strains happening at a quicker rate than normal, any quicker than the flu? This is one question, but I just want to be clear, you know, yeah, are they putting any faster, deadlier? Everyone?
So the COVID-19, the SARS-CoV-2 virus, my understanding from my laboratory colleagues is that the mutation rate in that virus and the occurrence of variant is not different than other coronaviruses. So it's not that it's mutating more quickly. However, you know, what is important to understand is that the more people that are infected, the more time opportunities that virus has to mutate. So there is an advantage in keeping case rates lower, in making sure that vaccine is getting to other places in the world as well, so that there are fewer opportunities for the virus to have a lifespan under which it can mutate. So the virus is not mutating more quickly than expected, is my understanding.
Okay. All right, well, I think we're going to wrap this up. Thank you once again to Dr. Longcallow, Director Hertel. I believe Dr. Caldoun as well was on. I appreciate you taking the time. If anybody has any follow-up questions, please feel free to send me an email at sutphinl1@michigan.gov. I will be sending out the presentation shortly to everyone. And then once we have the video posted online, I will also send you a link to that as well. Have a wonderful day. It is absolutely gorgeous out. I hope everybody gets some time out there. Bye-bye.